My title is PPPD and antidepressants. Please add S. I'm an otolaryngologist and a psychiatrist, double license. Then we perform otolaryngologic examinations and psychiatric examinations simultaneously. PPPD is a new chronic dizziness disease that has been introduced by the NES Society and is drawing attention. We report on the current status of PPPD at our psychiatric hospital. Persistent postural and perceptual dizziness, PPPD, has the background of 4 overlapping disease concepts. First, phobic postural vertigo, PPV, reported by Thomas Brandt. Second, space motion discomfort, phobia, reported by Ralph G. Jacob. Third, visual vertigo, reported by Adolfo Bronstein. Fourth, chronic subjective dizziness, CSD, reported by Jeffrey P. Stab. PPPD is accompanied by anticipatory anxiety about what to do if dizziness recurs, depressed mood, loss of self-confidence, etc. I met 3 of them at Akita ISPGR meeting in 2013. We show diagnostic criteria for PPPD. Dizziness are present on most days for 3 months or more. Symptoms are exacerbated by upright posture, active or passive motion, visual stimuli. Symptoms are not better attributed to another disease or disorder. We diagnosed PPPD with the following points. First, continued for more than 3 months from the first dizziness. Second, dizziness for more than 15 days in a month. Third, exacerbation in upright posture, body motion, and visual stimuli. I met Professor Stab and Bisdorf at Seoul Barney meeting in 2016. And I met Professor Bronstein at Toyama in Japan in 2019. He taught me to exclude dissociative disorders in diagnosis of PPPD. Now, I'm writing a Japanese paper about vestibular illness anxiety. Vestibular illness anxiety is different from PPPD. If I have a chance, I'll mention about it. So these subjects were 1,361 patients with dizziness. Patients were diagnosed as otolaryngologic disorder and psychiatric disorder using ICD-10. PPPD was revealed in 219 patients, 16%. Mean age was a little bit young, 58.4 years old, rather than all dizziness patients 60 years old. PPPD was revealed in 219 patients. In PPPD, psychiatric comorbidity was revealed in 204, 93.2%. This number was extremely high compared to 70% of all dizziness patients. Out of 204, various types of psychiatric disorders were found. Phobic anxiety disorder about 50%, mood disorder to 28%, adjustment disorder and PTSD 7%. Because PPPD was associated with anxiety or depression, we thought that antidepressant was effective for PPPD. We show PPPD and antidepressant. There were 4 types of antidepressants, such as SSRI, SNRI, NASA, and SRIM. In 2019 NES in Tokyo, we already reported sertraline SSRI therapy was effective for patients with chronic dizziness and depression. DHI scores were improved significantly, 66.2 to 30. We show VOR test in rotation. We measured eye and head movement. VOR DP% normal value is between -15 to +15. In certain study of VOR test, DP% scores vestibular function were improved significantly. We also experienced SNRI venlafaxine or NASA mirtazapine were effective for patients with PPPD. In particular, vortioxetine Trintlix is a new antidepressant. It has both effects, reuptake inhibitor like SSRI, SNRI, and receptor agonist like NASA. It's called SRIM, serotonin reuptake inhibitor and modulator. It has less side effects and effective well. Vortioxetine was easy to use. We therefore investigated the effectiveness of vortioxetine therapy for the patient with PPPD. Vortioxetine treatment performed 81 all depressive patients, 34 men, 47 women. Mean age was 57.1, with or without dizziness. We present a case of an 85-year-old woman. She self-harmed her left tongue and her right midline neck with a utility knife. She had chronic dizziness, delusions, and depressive symptoms. She took vortioxetine 10 mg and brexpiprazole 1 mg antipsychotics. Then she got better. About vortioxetine study for PPPD, the subjects were 24 patients, 8 men, 16 women, mean age 57.9. Last year, I reported 20 cases, this time 24 patients. DHI scores were improved gradually. Before 58.7, 1 month later, 43.5, 2 months later, 30. Regarding 3 cases that do not improve, 2 cases took 7 months to improve. 1 case has Parkinson's disease. This is a new consideration. Here, in order to evaluate the degree of improvement in depressive symptoms, we focused on the DHI emotional score. As an example, DHI emotional has many questions about depressive symptoms, such as frustrated, afraid to leave, embarrassed in front of others, intoxicated, difficulty to concentrate, handicapped, and depressed. DHI emotional is a perfect score of 30 points. 30 points. 39 point. Sorry. DHI emotional scores were improved gradually. Before 22, 1 month, 15, 2 months, 10. Regarding 2 cases that do not improve, but they took 7 months to improve. In viewer tests, in only 9 cases, last year I reported 7 cases, this time 9 cases. DP percent scores vestibular function were improved. Before 18.38 to 6.623. Discussion. We show the vestibular function in depressive patients. According to Sotza, depressive patients have bilateral low caloric response and right side were lower. Our sertraline study and in this study, depressive patients may have concurrent central vestibular disorder. So, no. We also show the usefulness of VR tests in rotation for dizziness patients with depression. VR tests were easier than caloric tests, and it can evaluate for peripheral and central vestibular function. About the effects of antidepressants on dizziness, we thought 2 reactions. First was central action, including the amygdala and vestibular nuclei. And second was improvement of depressive symptoms and improvement of dizziness symptoms. According to Sotza and our study, depressive patients may have central vestibular disorder. Therefore, it cannot be denied the antidepressants may act directly on the central nervous system, such as the amygdala and vestibular nuclei. In basic research, Dr. Simagari in our group examined how SSRI sertraline affects the vestibular system using Guinea-pig model. In sertraline clinical research, we believe that sertraline could possibly affect the vestibular system by the activation of a cyclic AMP responsive element blinding protein brain-derived neurotrophic factor, CREB BDNF system. We thought all antidepressants, includes vortioxetine, may have these effects. Conclusion. We report PPPD was reviewed in 16 cases, patients with 1,361 dizzy patients. Psychiatric comorbidity was reviewed, 93.2% patients with PPPD. This number was extremely high compared to 70% of all dizziness patients. We therefore investigated the effectiveness of vortioxetine therapy for the patient with PPPD. DHI scores were improved gradually. In VR test, in 9 patients, DP% scores vestibular function were improved. These results of the present clinical research suggest that vortioxetine SLIM might have some effects which improved the vestibular function in patients with dizziness and depression, as well as sertraline. Thank you very much.